y'all, Dr. Crocker Pet Vet here. Have you ever had to take your pet to the emergency clinic? Have you ever had a problem with your pet and you're not sure if you need to take them to the emergency clinic or not? Well, recently we've had a couple scenarios that have inspired me to make a video, and I decided it needs to be a two-part video. So the first part is going to be about the difference between an ER specialty clinic and a general practice, and what to expect and maybe where you should take your pet if they're having a true emergency. Now the second part is going to be if you are going to an ER facility, what to expect in terms of wait time, communication, and finances. So two-part series, we're gonna start part one now. I feel like I can speak to the differences between a ER emergency facility and a general practice because I work at both. I'm a full-time small animal general practitioner, and I also work as an emergency relief veterinarian. So I have both places that I work at and both experiences. So I can kind of speak to the differences that you as a pet owner really need to be aware of. Now, let's say you have a pet that is having a problem. The question is, where do you take them? And the answer is, it depends on the problem. Now, if your pet has a true emergency, and true emergencies I would say are a pet in respiratory distress with extreme bleeding, unresponsive, maybe having continuous seizures, hit by a car, recent dog fight, any of those things, you really should go to an emergency clinic. And I am speaking to people who live in a place where you have both general practices and emergency clinics close by. Obviously, if it's going to take 2 hours to get to an emergency clinic, an hour, then you probably need to go see your regular veterinarian or at least contact them and see the best place to go in your area. But where I live, there's a vet clinic on every corner, and we have an emergency facility every couple of miles. And so you really have choices about where you're gonna go. So again, if you have something that requires emergency attention, definitely you should go to the emergency clinic. Now, let's say you're frazzled, you don't know what to do. I would recommend you call your veterinarian and you ask them and you tell them what you're seeing, because a lot of times, just from what you describe on the phone, we can kind of send you in the direction that you need to go in. And the reason I say that is because we did have a pet present to us recently, and this pet, the owner did not call ahead of time. It had been hit by a car, and when they presented to us, it did take us a couple minutes to get the pet in the back, and the owner was a little unhappy about that situation. However, we're a general practice, we're not an emergency clinic. So the big difference, I think, between a general practice and emergency clinic, if you're looking for somewhere to go, is the staffing and the schedule. So in my general practice, I have appointments, I have surgeries I get done at certain times, and I have a lunch break. So I have a time period where a lot of my staff is gone, and sometimes a doctor's not even there, depending on who's taking lunch when. So if you walk in with your pet, there may not be someone available to help you. Now, an emergency clinic, they have no schedule. Their job is to sit and wait for you to walk in with your pet and for them to assess them. And if you need attention, they have vets and staff and technicians that can immediately assess that pet, bring them back, and start. So it is a little bit different expectation if you go into a general practice and you just walk in versus an emergency clinic. It would kind of be like going to your pediatrician with an emergency, and they would be asking you questions, wanting to know what's going on, versus if you walk into an ER with an emergency and they kind of can jump to it because that's their job, that's what they do. So if you're having an emergency, again, I would call your general practice, make sure there's a vet there, make sure that they're able to handle the problem, because you want the best thing for your pet. Now, the other thing is, along with the staffing, the equipment that's available. If your pet needs oxygen, which a lot of pets that are in respiratory distress or have been hit by cars or been attacked recently might need, a lot of us general practices, so again, standing veterinary clinics that do vaccines and spays and neuters, don't have oxygen cages or oxygen areas. And so it is hard for us to administer oxygen to those pets that truly are in respiratory distress. Now, I do think that the emergency clinic, pretty much every fully staffed emergency clinic should have multiple oxygen cages, different sizes for different pets, also with heating elements, which is really, really important for some of these pets that are in extreme shock. So the equipment makes a big difference. Now, blood products are another big thing that not all regular veterinarians have. Sometimes they have an animal that they can maybe get that's a staff member's animal that they can get blood from. But at the ER I work at, we have a blood bank. We have readily available different types of blood that we can pull, and we can pull it quickly. It's already been typed, it's already been tested. It's better for your pet, it's safer for your pet. And so if your pet is showing evidence of extreme bleeding, if their gums are really pale and white, I definitely would go somewhere that has blood products available and available right away. The other difference is specialties. So a lot of times, if you are a general practicing vet, you don't do a ton of emergencies. Our emergencies are the dog that's been vomiting and having diarrhea, or the pet that has really itchy skin and is really, really irritated by it. But a true emergency, we don't have as much experience in all the time. And so you are better served by the people who do it every day and they know what they're doing and the techs are on top of things. So again, this is for people who have the opportunity to go to either a general practice or an ER, and some of the things that you should think about. Now, I do think that some general practices, we do our best to stabilize pets and then we can send you to the ER. So if that's your only choice, or if you just can't even think, I think it's okay to go in and do that. You just have to realize that there are a little more limitations going into a general practice versus an emergency clinic. And the emergency hospitals, the staffs, they're amazing. They know what they're doing. And I do think that they are the place to go if you truly, truly have a really bad emergency. So that's part one, the difference between an ER and a general practice veterinary hospital. Now, part two, we're going to talk about what constitutes a true emergency when you really need to be going to that ER and what to expect when you get there. All right, we'll see you guys in part two. Thanks.